going to talk to you about the actual operation and what we do before we go over the frequently asked questions. And one of the most common questions is, what are the complications of the surgery? But before you understand about the complications or potential complications of this operation, I would like you to understand about the actual surgery and what we do during the surgery. So the abdominoplasty or tummy tuck, it involves the general anesthesia. So you go under general anesthesia and I make an incision in the lower abdomen. It's called bikini line incision. And as I said during the pre-operative evaluation, we mark the abdomen and basically place the incision as low as possible in the bikini line so it does not expose after the surgery. Now, then we lift up the skin off of the abdominal muscle. We separate the skin off of the abdominal muscle all the way down to the rib cage, right in that area that you can see the marking area. And then now we have the exposure of all of the abdominal wall muscle. So now we fix the muscle laxity, and obviously if the patient has a hernia, we fix that at the same time by approximating and folding the muscle to each other and tightening the abdominal wall. And that can be done in a different type and directions, depending on the problem of the patient. Sometimes it's vertical if the patient has a very large diastasis recti, or even horizontal if they have a very poochy abdomen in the lower abdomen. And then I will determine that during the surgery. So we tighten the abdominal muscle and then we pull the skin down all the way, and then cut the extra skin in the lower abdomen, and then reattach the rest of the skin down here to the lower incision. So by doing that, we eliminate the problematic extra skin, which usually, especially in patients who have multiple pregnancies, associated with the stretch marks. And that skin completely separates and thrown away. But then also this part of the skin, which we call it a skin flap, that we bring down, we need to make sure that it's not very thick. Because some people that have extra fat in that area, we have to then combine some sort of a liposuction to make that flap a little bit thinner, and also to create the appropriate lines that gives the patient athletic appearance after the surgery, and that will be done at the end of the surgery. While we bring down the skin and we pull it, we basically creating a lot of pressure in the abdominal wall, and therefore if the patient is extremely obese, there's limitations of how much you can pull, and that's why very, very morbid obese patients are not a good candidate for this procedure before they go under some sort of a diet or bariatric surgery or weight loss operations. Now, because we create a significant amount of space between the skin and muscle, there's a significant amount of free space between these two structures, and we place a special sutures to approximate these two structures together at the end of the surgery, or place a drain to make sure that we suck out extra fluid after the surgery so they don't develop problems. And that's why patients would have a drain after the surgery. So when people talk about abdominoplasty, this is the procedure that is done. And at the end of the procedure, we save the umbilicus and we recreate the umbilicus in the new skin flap for the patients. The there are also patients that don't have as much extra skin, and they're not as obese, and they're actually, some of them are athletic, and mostly they have muscle laxity rather than extra skin. Those people are a great candidate for called mini abdominoplasty, which the incision is smaller right in that area. We actually save the belly button, and we don't cut the belly button at all. We fix the abdominal wall muscle and tighten the muscle, and just bring the skin slightly and cut the extra skin, and reconnect the belly button in a little lower position, but more aesthetically acceptable location. And those people, they have they call mini abdominoplasty, and a lot of patients, especially the young, thinner female who had multiple pregnancies, and because of that they develop poochiness in the lower abdomen, but they don't have extra skin as much and extra fat. That's the best type of operation that is needed for those people. Now that we address the actual surgery, I can discuss with you the complications. So one of the very common complications is seroma after the surgery, which is accumulation of tissue fluid underneath of the skin, between the muscle and the skin. As I said, abdominoplasty involves separating the skin off of the muscle and creating the free space in order to pull the skin down. And that free space is a great space for your body to produce extra fluid, and that extra fluid, which is usually a yellowish color, a very clear liquid, is called seroma, and the majority of times that drain will capture that and prevent that to happen. If people develop seroma later and there's no drain to take it out, sometimes we need to address that in the office with draining them in the bedside after the surgery. The other risk is bleeding. Again, there's a huge dead space between the skin and muscle, and sometimes little tiny vessels that start bleeding after the surgery. That risk is very, very low, but that can cause bleeding after the surgery, or called hematoma, which is the blood clots, and that needs to be sometimes drained. It depends on the extent of hematoma or the size of hematoma. Risk of infection is less than 1%. That's very low in this procedure, but most of the patients, they will receive antibiotic prior to the surgery and also after the operation, as long as they have a drain. The skin changes and sensation is very common. Majority of times is reversible, and it comes back after a few months, but there are situations that the people get sort of a numbness, especially around the incision area, because we're cutting the nerves obviously in that region, and that can happen. So changes in the skin sensation is one of the problems that can happen, and can be temporary or even permanent. Fat embolism, especially in people who we do liposuction and combine the liposuction with them, sometimes it goes into the blood vessels and goes to the lung, and they can develop respiratory problems and even death, which is extremely low, but it's one of the risks that you need to know. DVT or blood clot during the surgery, and usually happens in the leg, and that can travel to the lung and can cause trouble. We usually give the patients called sequential stocking, which is the stocking that has the pumping system and pumps the blood during the surgery and decrease the risk of developing blood clots. However, the risk of blood clot even stays for 1 or 2 weeks after the surgery. That's why we recommend the patient to walk around after the surgery to increase the circulations in the leg and decrease the possibility of blood clots. The cardiopulmonary issues are not very common, but it's a possibility because we pull the skin and we pull the muscle, and there's tightness in the abdomen, so some of the patients, they have difficulty breathing after the surgery, so they can develop pneumonias or collapsed lung after the operation. So that's why we recommend the patient not to smoke at all before surgery and after the operation, and also do deep breathing exercises. Intra-abdominal damage are very uncommon during the abdominoplasty because we're operating on a surface unless the patient has very large hernia that I need to fix during the surgery. So then sometimes the intra-abdominal structure can be exposed and we fix that during this operation. The risk of intra-abdominal damage to the intra-abdominal structure also is associated with liposuction. That's extremely rare, but that's one of the problems that can happen for the patients. Contour irregularity is very common, especially the first 3 to 6 months before everything settled down. Some people develop localized swelling and that create a little unevenness on the skin, and the majority of times if it's not an actual seroma that we need to drain, we usually wait and use the abdominal binder or compression garment, and then gradually your body will settle down and it will be even. But contour deformity and irregularity is one of the problems. We said that during the surgery we separate the skin all the way up to the rib cage and bring the muscle, bring the skin down after we tighten the muscle. So that skin flap has a decreased blood circulation. And there are situations that right at the edge, when we sew up the skin to the lower abdomen, they can get a skin necrosis or ischemia or lack of circulations of the skin, and that can create a necrosis or dead skin. And a lot of times we need to whether excise it or debride it, and sometimes we just use conservative therapy, wait, use the antibiotic ointment, and it will go away by itself. Or if they develop a bad scar tissue, we can revise them later. The scar tissue also is very important because there's tension on the scar. Some people develop white scar tissue and sometimes it gets pigmented and they don't like it, and that's another thing that we can revise that later when they heal completely.